So today we will be discussing the most common types of insulin with first-year nursing students. The American Association of Diabetes recognizes four clinical classifications of diabetes: type 1 and type 2, gestational diabetes, and diabetes caused by genetic defects or medications. In this presentation, I will focus only on type 1 and type 2 diabetes. So in type 1, this is a chronic autoimmune disease that can sometimes be genetically inherited, causing the body to stop producing insulin, which is a hormone secreted by beta cells from pancreas necessary for the uptake of glucose from the bloodstream and into the body cells for energy. When we eat, carbohydrates are broken down into glucose. Without insulin, the body's glucose level will simply increase, which will lead to life-threatening ketoacidosis. In type 2 diabetes, this is a chronic condition as well that is acquired due to the body's inability to use insulin, called insulin resistance, or simply the lack of sufficient insulin secretion. So a combination of factors including lack of physical activity, being overweight, genetic predisposition, age over 65, and poor diet can all contribute to the incidence of type 2 diabetes mellitus. So there are three main types of insulin that fall under the categories of fast-acting, intermediate-acting, and long-acting. But I will only be discussing fast and long-acting insulins. So insulin aspart, lispro, or glulicine are fast-acting insulin analogs that work quickly, mimicking the mealtime release of insulin and help control postprandial glucose. The onset of action of these insulins is less than 15 minutes with a peak effect in 1 to 2 hours and a duration of action of 4 to 6 hours. Insulin glargine or detamere are long-acting insulin analogs that work slowly over an extended period of time with minimal to no peak effect to control glucose levels at bedtime and between meals. The onset effect of this insulin is 1.5 to 2 hours, which plateaus in the next few hours and has a flat duration of 12 to 24 hours for insulin detamere and glargine respectively. So I've included a table of different types of insulins, including their onset, peak, and duration times. The most common adverse reaction to insulin is hypoglycemia, which can be very dangerous and must be treated and corrected. So all diabetics should know how to treat and correct a hypoglycemic episode. Another reaction of taking insulin is weight gain. Local injection site reactions can also occur, such as the development of scar tissue, and the importance of rotating injection sites can help avoid lipodystrophy. So as for the cost of insulin, Humalog being one of the most expensive is roughly $325 for a 10 milliliter vial, while Admelog is priced at around $200 for a vial, and the authorized generic of Humalog is priced at $170 for a 10 milliliter vial, plus the cost of a box of 100 syringes, which can cost $15 to $20 in price. As for a box of 5 Humalog insulin pens, this can cost over $600, with its generic running over $300. As for Admelog, this can cost as much as $150 per box for 5 3 milliliter pre-filled insulin pens. When insulin is used appropriately and at the right dosages, the expected outcome is that adequate management will lead to control of blood glucose. The goal is to help reduce the complications of having diabetes, which can lead to blindness, neuropathy, slowed wound healing, limb amputation, nephropathy, and cardiovascular disease. So I hope this presentation has been informative and helpful on the topic of diabetes.